Silver Linings Playbook by Haley Carson. The character. Pat Salentio Jr., the main character from Silver Linings Playbook, is an explosive middle-aged man whose main objective in the movie stems from an intense altercation with his wife and the cheater she was sleeping with. Pat, due to his bipolar disorder, became destructive and hostile when he discovered the situation. He continuously beat the offender who cheated with his wife to the brink of death. Due to his condition, he was sent to a mental hospital to conquer his demons, be on medication to mediate his unstable explosions from his manic depressive disorder. Despite his offense, Pat strongly blames his parents for the instability of his disorder and believes his dad's obsessive-compulsive disorder had a negative impact in his own disorder. His diagnosis is exhibited by scenes and key drastic changes from high positive reactions to low positive reactions throughout the movie. The diagnosis. Although Pat's diagnosis is revealed before the movie as bipolar, I believe that the character is diagnosed with this due to his constant fluctuations in behavior from high positives to low negatives throughout the movie. Bipolar disorder is a psychological disorder that affects people's mental and emotional patterns and is not influenced by outside events, but can be stimulated by events. Pat specifically was strongly affected by his cheating wife and his overbearing family dynamics. His personal bipolar disorder is described as personal decreased need for sleep, as he has trouble sleeping at night, and strong flights of ideas, his need to pursue his love at Nikki, where she teaches. Support the diagnosis. Although I believe Pat has specifically bipolar 1, both types of bipolar are relatively similar in symptoms. Pat's symptom is evident in the film by his talkativeness throughout the dinner party with Tiffany and her sister, where he blatantly asked Tiffany all the medications she's been on. His explosive behavior as attacking his wife's lover she cheated with was also an example of a person's bipolar disorder once they're in a manic episode state. A person in a manic episode state has an elevated positive response to smaller stimuli, and the behaviors exhibited during this stage encourage more manic behaviors. Missing symptom. As stated, bipolar disorder has many other symptoms besides dramatic changes in positive behaviors and negative behaviors. The positives are classified as manic episodes, which consist of inflated self-esteem, decreased need for sleep, talkativeness, flights of ideas, distractibility, increased goal-directed activity, and excessive involvement in high-risk activities. From these traits, Pat typically doesn't exhibit distractibility, as he read all the way through Ernest Hemingway's A Farewell to Arms in One Night. Possible treatment. During a scene in the movie that Pat has Tiffany discussing the drugs they were taking, it is said that although he stopped taking lithium, Seroquel, and Abilify. All these drugs listed are used to help and aid bipolar disorder or manic depression. Klonopin, which helps with anxiety, panic disorder, and seizures, is also used. To deal with his depression during his negative depressions, he took trazodone. All these medications, however, he stopped taking because it flattened him out, as he said. Most times, bipolar patients stop taking their medications due to the fact that they brings them to a leveled emotional state and they miss their manic episodes. That said, the treatment with the most success rate would be to get rid of the irritating or motivating stimuli, in this case his obsession with Nick. He was also participating in therapy. I do think therapy is a good idea, but his therapist that he was talking with was using negative or personal stimuli to evoke emotions about his wife, such as playing him and his wife's wedding song to monitor his reactions. This is not presenting a stable environment to help with his bipolar issues, but instead fueling the fire. For Pat, he needs a therapist that will simply listen in and monitor his reactions or emotions, but not influence them. He needs to find a drug that will also help with his manic episodes, as he rarely has negative or depressive episodes. I would recommend taking Depakote as a mood stabilizer, as he does not tried this medication yet, and it is said to help with mania, mood swings, and delusions. Since he has tried a myriad of drugs, my recommendation would be trying Depakote every day to help with his explosive manic episodes, but also with his mood swings. To help with the longing for his manic episodes, non-stimulating therapy such as client-centered therapy would be helpful, as he can express his emotions and his therapist can work on it with him together. Therapy that is suited to help his bipolar disorder without stimulating features will also be beneficial to him in the long run, because he can safely and accurately depict how his life is going, how his meds are treating him, and how to control or stimulate his environment. Focusing on specifically Pat's bipolar disorder, I believe that bipolar 1 is accurately displayed in Silver Linings Playbook due to the fact that he is explosive in his manic episodes and exhibits a lot of the behaviors and people in manic episodes throughout the film. However, to make it more accurate, I think they should have portrayed Pat's depressive states. The film makes an array of psychological disorders seem to always be in a tense state. That is not necessarily true. They are people who just need a little help and can survive a normal life with some guidelines. The characters accurately depicted life for people with disorders and how every day is a process. The movie depicted people with disorders as trying to improve themselves, and it did not cast the characters in a negative light. Overall, Silver Linings Playbook did raise awareness of their psychological disorders, but also entertained audiences with minimal errors.